Another day, another story. Angelman syndrome is a condition caused by a change in a gene, called a genetic change. Angelman syndrome causes delayed development, problems with speech and balance, mental disability, and, sometimes, seizures. Many people with Angelman syndrome smile and laugh often. They tend to be happy and easy to excite. Welcome to Tabo. Eminent channel delays in maturing, called developmental delays, begin between about 6 and 12 months of age. The delays often are the first signs of Angelman syndrome. Seizures may begin between the ages of 2 and 3 years old. People with Angelman syndrome tend to live close to a typical lifespan. But the condition can't be cured. Treatment focuses on managing medical, sleep and developmental issues. When to see a doctor? Most babies with Angelman syndrome don't show symptoms at birth. The first signs of Angelman syndrome most often are developmental delays. This includes lack of crawling or babbling between 6 and 12 months. If your child seems to have developmental delays or if your child has other symptoms of Angelman syndrome, make an appointment with your child's healthcare professional. Causes. Angelman syndrome is caused by changes in a gene, called a genetic change. It's most often caused by changes in a gene on chromosome 15 called the ubiquitin protein ligase E3A, UBE3A, gene. A missing or damaged gene. You receive your pairs of genes from your parents. One copy comes from your mother, called the maternal copy. The other comes from your father, called the paternal copy. Your cells most often use information from both copies. But in a small number of genes, such as the UBE3A gene, only the copy from the mother is active. Most often, the maternal copy of the UBE3A gene helps the brain develop. Angelman syndrome happens when part of the maternal copy is missing or damaged. So the brain can't get the information it needs to develop and control speech and movement. Risk factors. Angelman syndrome is rare. Researchers often don't know what causes the genetic changes that result in the disease. Most people with Angelman syndrome don't have a family history. But sometimes Angelman syndrome may be passed down from a parent. Complications. Trouble feeding. Trouble sucking and swallowing together may cause feeding problems in infants. Your child's healthcare professional may suggest a high-calorie formula to help your baby gain weight. Hyperactivity. Children with Angelman syndrome often move quickly from one activity to another, have a short attention span, and keep their hands or a toy in their mouths. Prevention. Rarely, Angelman syndrome may be passed from an affected parent to a child through changed genes. If you're concerned about a family history of Angelman syndrome or if you have a child with the condition, seek medical advice. Your healthcare professional or a genetic counselor can help you plan future pregnancies. Genetic cause. Angelman syndrome is typically caused by a loss of function of the UBE3A gene on the maternal chromosome 15. This can occur due to a deletion, mutation, or other genetic mechanisms that affect the gene's expression. Symptoms. Developmental delays, including lack of crawling or babbling at 6 to 12 months. Intellectual disability. Speech impairment, with minimal to no use of words. Movement and balance disorders, ataxia. Seizures, often beginning between 2 and 3 years of age. Behavioral uniqueness, such as frequent laughter, smiling, and an easily excitable personality. Sleep disorders. Diagnosis. Diagnosis is usually made based on the clinical symptoms and confirmed with genetic testing that can identify the underlying genetic cause. Management. There is no cure for Angelman syndrome, so treatment focuses on managing the symptoms. This can include anti-seizure medications, physical therapy, communication therapy, and behavioral therapies to help with development and quality of life. The discovery in 1965, Dr. Harry Angelman, a British pediatrician, observed 3 children in his practice who exhibited similar unusual characteristics. These children had severe developmental delays, a happy and excitable demeanor, and frequent laughing fits. Intrigued by this pattern, Dr. Angelman conducted further research and documented his findings in a medical journal, thus bringing the condition to the attention of the medical community. He named the disorder Angelman Syndrome, after observing a painting titled "A Boy with a Puppet" by the Italian artist Giovanni Francesco Carotto, which reminded him of his young patient's behaviors. The genetic puzzle years later, advances in genetic research uncovered the root cause of Angelman syndrome. Scientists discovered that the disorder is linked to a defect on chromosome 15, specifically involving the UBE3A gene. Under normal circumstances, a person inherits one copy of this gene from each parent, but in certain areas of the brain, only the maternal copy is active. In individuals with Angelman syndrome, the maternal copy is either missing or mutated, leading to the characteristic symptoms. The impact on families living with Angelman syndrome poses significant challenges, both for individuals with the disorder and their families. Parents often notice developmental delays within the first year of life. Simple milestones like sitting up, crawling, or speaking may be delayed or absent. The diagnosis process can be lengthy and emotionally draining, as it involves numerous medical tests and evaluations. Despite these challenges, many families find strength in their children's joyful and resilient spirits. Children with Angelman syndrome are often described as having a sunny disposition, characterized by frequent smiles and laughter. This unique aspect of their personality can be a source of comfort and joy, even amidst the daily struggles of managing the syndrome's symptoms. Advances in research and treatment in recent years, there has been significant progress in understanding and managing Angelman syndrome. Researchers are exploring various therapeutic approaches, including gene therapy, to correct the underlying genetic defect. One promising avenue is the development of treatments that aim to activate the paternal copy of the UBE3A gene, which is usually silent in the brain. If successful, this approach could potentially mitigate or even reverse some of the symptoms of the disorder. Support and advocacy. Numerous organizations and support groups have emerged to provide resources and advocacy for those affected by Angelman syndrome. The Angelman Syndrome Foundation, for example, offers support services, raises awareness, and funds research initiatives. These organizations play a crucial role in connecting families, sharing information, and fostering a sense of community. A story of hope. One inspiring story involves a young girl named Emily. Diagnosed with Angelman syndrome at the age of 2, Emily faced many challenges, including difficulties with mobility and communication. Her parents, determined to give her the best possible quality of life, enrolled her in various therapies and sought out the latest treatments. Over the years, Emily made remarkable progress. She learned to use a communication device to express herself and participated in adaptive sports. Her infectious laughter and positive attitude brought joy to everyone around her. Conclusion: Angelman syndrome is a complex and challenging disorder, but it is also a story of scientific discovery, resilience, and hope. As research advances and communities come together to support those affected, there is optimism that individuals with Angelman syndrome will continue to lead happy and fulfilling lives. Through awareness, advocacy, and innovation, the journey to understanding and overcoming Angelman syndrome continues. Thanks for watching. Request you to subscribe the channel.